Good morning, everybody. My name is Ralf Kindervater. I'm CEO of BIOPRO Baden-Württemberg. I would like to thank for the invitation to give you a short keynote to give you an idea about our work in Baden-Württemberg. My short presentation is titled Formation of a Fully Integrated Translational Innovation Ecosystem to Support Joint Efforts for a Borderless Health Data Generation and Exchange in Europe. First of all, we have to see what ingredients do we need for a powerful digitalized pan-European healthcare system platform. We need to have agreed joint concepts for healthcare data formats, storage, distribution conditions, and safety issues with all data we are using in healthcare research and healthcare applications. We need open-minded policymakers, agile entrepreneurship and startup environment in Europe and in all our states and regions. We need strong regional clusters as integrators and drivers of such development, multidisciplinary translational innovation hubs focusing on digitalization and artificial intelligence, novel contexts for healthcare-oriented policy development and execution, a broad access to novel technology approaches like artificial intelligence and quantum computing in the future. And we need a strong infrastructure and a strong joint interconnected infrastructure to have a chance to set up Europe's cutting-edge healthcare system. Now, I would like to introduce you into some current developments in our state, in Baden-Württemberg, in the southwest of Germany. Maybe it's a kind of recipe for such a development. I will not be in a position to tell you all the recipes and all the ingredients, but I will focus on the major three. First of all, it's a strong infrastructure. So what we need to access and to interconnect is a science and research infrastructure with all universities, universities of applied sciences, university hospitals, and also the non-university research institutions. We need a strong economy, which we have in our state, with around about 1,200 companies in the industrial healthcare sector, in order to have a chance to interconnect and derive the upcoming products of a digitalized healthcare system. And we need the healthcare provision system, because they are the application fields, the test beds, and also the later application sites for all those things. First of all, they serve data, and in the last, they receive the updated, innovative digital products of the future. Next thing is we need regional clusters and statewide networks as integrators and drivers. And the screen I will show you now is just a selection of some typical clusters we have in our state and that we are using to get access to each and everyone in the race. We won't have the time to go through it. I just want to tell you that there are several biotech clusters like BioRN, like BioRegio Stern, like the BioValley Germany in Freiburg, and in pharmaceutical-wise, BioRegio Ulm. But we also have strong medical technology clusters like Medical Mountains in the Tuttlingen area and the Mannheim Medical Technology Cluster in Mannheim, which is really very much ahead of developments in terms of interconnecting clinics to researchers and to companies. But this is just a broad overview. In addition to this, we also have a statewide coordination organization, KTBW, which is accompanying digital health projects from the early phase into the application in medical technology and in the healthcare system. So the third point that I would strike is healthcare-oriented policy development and execution, because this is an important point that the policymakers are being addressed and that they become active in order to counter the threats that we have in the healthcare system in our state, in Germany, but also in Europe. because we have internationally a very competitive structure. There are radical changes in the healthcare landscape underway. And what all of us know, we have increasing regulation issues with medical devices regulations and also with in vitro diagnostica regulations upcoming. On the other hand, we have a dramatic reduction in time of knowledge and innovation cycles. Everything gets faster. Everything needs to be much more multidisciplinary, such the requirements for successful top-level medical research get higher and higher. And in terms of the healthcare system, we have always rising costs. We have shortage of specialists. We have a radical demographic change. People grow older. And we have individualized medicine, which is not a bad fact, but the way to live individualized medicine and to pay for individualized medicine is a really hard game that we have to cope with. So thus our state government, together with many players in Baden-Württemberg, have set up a so-called blueprint, a novel way to make policy, which is called Forum Gesundheitsstandort Baden-Württemberg, the logo of which you see in the lower left. So this is something really new. It's like a house of interaction and communication, guided by our Prime Minister, Winfried Kretschmann, and together with 3 ministries. You see at the bottom the Ministry of Science, Research and the Arts, the Ministry of Economic Affairs, and our Health Ministry, which is called Ministry of Social Affairs and Integration. And these 3 ministries do not work in their ivory towers, in their ministerial compartments. They have made up their mind to interconnect their activities, together with up to now more than 600 actors out of research, of science, of the healthcare industry, of the healthcare system, of the cost units, and of many associations guided by my or coordinated by my organization. We made a really big effort to get things moved and managed in our state and to make a healthcare system and the whole healthcare industry as a future driver in our whole economy in Baden-Württemberg. So therefore, we had to establish a translational cycle for data usage and data exchange, because our experts have found out that the digitalization and the access and usage of data, of medical data, health data, is a critical factor in such a development. And thus, you see here the 3 programs of the 3 ministries I just mentioned. We interchange all digitalization efforts between the research and the science field into the Ministry of Social Affairs and Integration, and further on to the Ministry of Economic Affairs, to get all the companies up and running with data so that future developments can take place. And to have a translational cycle, of course, we then have to go back and to use such data also back and the products of such in the research of the future. So this is the translational cycle that we have established, or that we are about to establish in our state. So now those were the ingredients. I couldn't point them all. But in the end, the question is, if we would like to do such, how do we proceed? Because the fact that we are doing is we need to synchronize our work, because we have so many medical technology and healthcare clusters in Europe. And from the single recipes of each and every one in this group, we need to develop a joint menu card to have an agile European healthcare system platform. So what you see on this European map, we have so many cooks on the table with so many concepts. And therefore, next question is, could a setup of a fully integrated translational innovation system that I have postulated in the beginning of my talk, could this help to get a solution in terms of European-wide data exchange? And this is my suggestion, and please let's discuss if we can get this many cooks into a joint recipe book. for the future of healthcare system in Europe. Thank you very much.